For our evidence-based practice project, we will be talking about distraction therapy for dementia patients. Our group members consist of Taryn, Angie, Grace, and Alex. Our PICO question is patients with dementia who are agitated with an intervention of distraction therapy in addition to pharmacological interventions compared to pharmacological interventions only, and the outcome being patients that are CAM positive will have decreased agitation and or need less pharmacological interventions when distraction therapy is used in conjunction with pharmacological therapy. The background of this subject from article Managing Challenging Behaviors in Dementia by OU in 2018, dementia is a cognitive decline that is irreversible. Common symptoms are delusions, agitation, insomnia, and hallucinations. Symptoms can flare up when needs go unmet. Symptoms can be managed by setting routines for ADLs, use of distraction, ignoring the behavior but not the patient, allow personal space, use of memory aids. Non-pharmacological interventions should be tried before use of medication. So agitation and behavioral issues can be present when caring for dementia patients. One factor causing agitation in dementia patients is due to patients being taken outside of their normal environment by being in the hospital. The unfamiliarity of being in a different environment can trigger dementia patients to become more confused and agitated. To provide best care for patients who have dementia, it is important to also factor in their level of cognition. Once a dementia patient gets agitated, it does not allow for the ultimate opportunity to provide patient care at that time. Having measures in place, such as distraction techniques, may help allow for management of agitation and behavioral issues in dementia patients.
So our first article talks about the use of tablets with dementia patients as a method of distraction. So this was an open label study that studied 36 geriatric patients with dementia, and it happened on an inpatient unit. The tablets were given to dementia patients whenever they became agitated or restless. They were rated on the MOCA agitation scale of either being mildly, moderately, or severely impaired. Whenever the nurses or the volunteers of the study noticed the symptoms of agitation or restlessness, they gave them the tablets, and the average time used for those was about 20 minutes. The most common applications used were YouTube, internet browsers, Pandora, and game and puzzle applications, and they also were able to video call their family. All patients were able to tolerate the tablet use, but the mildly impaired patients benefited most from the tablets. A couple of limitations from the study were that it just involved 36 patients, so the sample size was not very big, and also to take into account the different experience levels that each patient had with tablets. Some were familiar with them and some were not. And the strength of this study support other articles that show that dementia patients can benefit from the use of tablets for a method of distraction. So our first article talks about the use of tablets.
So the article I had was titled Physically Violent Behavior in Dementia Care. This article studied 309 residents with dementia in 40 different group homes. Primarily, the study aimed to compare two different types of behavior management of residents' violent behavior. The study outlined two different forms of behavior management. It includes symptom-oriented and person-oriented management. So symptom-oriented management was found to be used more frequently than person-oriented. And symptom-oriented management includes the use of medication, isolation, and distraction behavior management, which was not as effective as person-oriented management. Person-oriented includes the knowledge of the resident's personal behavior history and the staff's ability to interpret body language. A tailored approach to each resident was found to be the most successful in managing these violent situations. And knowing how the resident responds normally allowed the staff to respond more effectively in turn. So really knowing your audience and knowing how to respond can decrease the use of medication, violent restraints, and even the use of distraction. However, this is not always feasible in the way hospitals work. In nursing homes, this could maybe be used more effectively because they know their residents and sometimes work with them for many years. A strength would be that staff and residents from different group homes were tested, and this can expand the population number and variety within the population. And a weakness would be that more men than women were tested, and this possibly showed some skewed results regarding violence within the study. So my second article was titled Visual Art and Anxiety and Mental Health. This study interviewed 22 nurses working with psych patients ages 18 to 65 years old who exhibited agitation and anxiety while under their care. So the study compares the use of visual art on a facility's walls versus the absence of visual art and the amount of PRN anti-anxiety medications given. The study showed that the PRN dispenses decreased when some form of visual art was on the walls. Visual art was found to be a form of positive distraction in those with agitation and anxiety. And this form of distraction also saved the hospital and patients a combined total of $27,526 over the span of 72 days. The use of landscape art was the most successful in lessening agitation compared to abstract and abstract representational art. Overall, dementia patients in the hospital are taken out of their familiar territory. This can cause increased agitation and anxiety. Even if the nurses resort to pharmacological means to lessen agitation, nurses could implement art as a first line of defense. The strength would be that the study confirms that there are alternative options to controlling anxiety and agitation. A weakness would be that this article focuses on anxiety and agitation, not solely on dementia. However, dementia produces a lot of the same feelings treated in this study and therefore become pertinent to the same type of population.
Our last article talks about the special needs of the hospitalized patient with dementia. This is a meta-analysis of many research articles on the topic. It goes through many important things to keep in mind with dementia patients, such as how communication is an important aspect in caring for and preventing behavioral episodes, and it gives many communication tips throughout. It also discusses agitation in dementia patients. One suggestion that stood out the most is that pharmacologic interventions should only be used in the presence of violence. They also suggest that if you have to use pharmacologic interventions, to also attempt to incorporate non-pharmacologic interventions as well. The article then goes on to discuss important factors to consider when treating a dementia patient, such as hygiene, nutritional needs, spiritual needs, and pain management, which found that some behavior episodes are the result of dementia patients not being able to express that they're in pain. So some research suggested treating the pain first before using any psychotropic medications. Finally, the article gives a variety of diversional activities and non-pharmacologic interventions that have been found to be effective. However, the best method is to personalize your interventions to the patient based on their history and interests. This is found to give the best overall results.
Our recommendations. There is still a need for further research to be conducted on interventions that are beneficial to care for a dementia patient who can become agitated. Many studies display there is a need for interventions to best manage dementia patients' behavior, such as getting agitated. Studies evaluated also express the importance of interventions to help prevent, decrease, and suspend the action of an agitated dementia patient. One form of intervention being distraction therapy. Utilizing distraction therapy could help in the care plan of patients who have dementia and can get agitated. Further studies can help elaborate on this technique. If there are any questions about the presentation, please contact me, the group leader, Grace, at my email. Listed here are references used during this research. Thank you for watching our presentation.